Hi, my name is Jamie Riddell. I'm a neonatal nurse practitioner with Seattle Children's Hospital, and I've been working here at Providence since 1996. I started as a LPN and just worked my way up through the ranks. So I've done everything from LPN to RN to nurse practitioner. I understand that education really helps us do a better job, and so we really want to talk today about the late preterm policy. One thing I really want to reiterate is that these babies cannot just be treated as if they're normal term babies. So oftentimes they might be the same size of a term baby, they might appear to be a term baby, but the fact that they're 3 to 5 weeks early really puts them at higher risk for additional morbidities. Some of those morbidities involved are things like increased respiratory distress, hypoglycemia, hypothermia, significant weight loss or dehydration, and poor feeding. So we really want to just go over each of those ideas and talk about how we can prevent those issues from turning into significant problems that the baby has to be admitted to the NICU for. We also have an increased risk of readmission for these patients. These patients encompass about 70% of readmissions to the hospital in the first week of life. And so the best thing that we can do is good monitoring while they're in the hospital, good education for the families prior to discharge, and make sure that the surveillance once they're home is adequate so that those babies don't fall in the cracks and end up getting readmitted for being sick. So one of the best things you can do prior to delivery is establishing the gestational age and discussing that with the family, making sure that they understand that the baby's metabolic and physiologic immaturity can lead to complications once the baby's born. I think it's very helpful to start education prior to the baby being born so that the family is not surprised that they may need to supplement their baby, or that bathing may be delayed, or that breastfeeding support is available. Just having them understand all the things that are going to encompass care for their late preterm baby is really important. Education is 90% of the battle, and having them be able to care for their babies once it's born, prepare for their baby to go home, and then also making sure that they're prepared to monitor their baby once home and get a hold of the doctor if something does go wrong.